Late Night Health continues. Our guest is Eric M. Stone, the CEO of Volano Vascular. We have a lot in common. We like wine, we found out, and we've agreed that even though having a blood draw is painful, spending 3.5, 4 hours with young kids on a drive is not fun, and may be preferable to having a blood draw may be preferable to having the kids in the car. I don't know. Eric, we were talking about PIVO. What is PIVO? P-I-V-O. That is the unique device that you're presenting to the healthcare industry right now. Third time is the charm, as we said, to the FDA. What does PIVO stand for?
So there's no formal representation for PIVO. You can come up with whatever it means that works for you, but it is the first commercially available vascular access technology that our company has brought to the market, and the first of many as we continue to build out a suite of solutions that help clinicians do their job more effectively.
You're really working for the patient.
I am the patient, and we are very much working for the patient, and we're working for the practitioner as well.
Got it.
Put yourself in the shoes of the phlebotomist with a needle drawing blood on an HIV patient, and the feeling and sense of both impact and risk that you feel when you're drawing blood on potentially a combative patient with a needle, and the risk that you expose yourself to if you stick that patient and then you stick yourself.
Right.
So what we're doing is very much for patients and practitioners, and it's also for hospitals. It's unequivocally a win-win-win, and we've yet to find anyone in 6 years of building out this technology and this procedure that has been able to point out any stakeholder in the healthcare industry that loses by what we're doing.
And how is the community, the medical community itself, accepted this? Are they welcoming you with open arms, or are they a little reticent?
We've seen a little bit of everything. For the most part, the general reaction is, this is exceptional, and it's so straightforward, and why didn't I think of that? The number of times we've heard that is pretty immense, pretty significant. With that said, practice change is not easy, and healthcare is certainly an industry that is loath to change. So it's wonderful to have a great widget. It's great to have a better way. But if you don't consider the folks who that change is affecting, what their incentives and motivations are, then you're certainly destined to failure. And we've been very cognizant of that, and that has informed a crawl, walk, run approach that the organization has taken since day one.
And are you at the fast walking stage right now?
We're just about to start sprinting, in large part because of that third FDA clearance that you referenced earlier, and in large part because some of our early hospital partners and collaborators have gone through an extensive diligencing process on the technology and the procedure and made the determination that this is going to be their standard of care.
And have major hospitals, HMOs, adopted this? We're in California. Kaiser is the largest HMO, not only in California, but I believe in the country, and other hospital networks.
They have. The most recent to announce their implementation of PIVO is Intermountain Healthcare, based in Salt Lake City, Utah. 22 hospitals, and arguably one of the most effective and most forward-thinking of health systems from the perspective of quality of care and the quality of care movement. You referenced California. Sutter Health is one of our customers and a health institution that we have been working with for some time now. It's not available in all Sutter hospitals, but certainly in select hospitals. And, of course, part of an ongoing consideration on their part, as is the case with all the hospitals that we're working with, for expanding PIVO usage and adoption more broadly.
as consumers listen to this, and unfortunately they have to go into a hospital, should they ask for this to their doctors, the phlebotomists, the nursing staff? Should they say, I want Pivo if you have to take blood?
That's a tough question to answer. It puts me in certainly an interesting position, because anytime you have a first-to-market technology, you've spent years proving through clinical data and practice patterns that you can do what folks have told you for decades cannot be done, there is a necessity for a crawl, walk, run approach. So are we as an organization supporting all 5,500 hospitals in the United States? No. Would, if a patient came into the hospital and asked for this, it create some level of unrest on the part of the hospital? Possibly.
Or
at
interest.
At the same time, would that hospital call us up and say, how do we get Pivo? And would that help us to establish the standard of care? 100%.
Terrific. Eric, I look forward to speaking to you again as you're not only sprinting, but charging down that roadway of health. Volano Vascular CEO has been our guest, Eric M. Stone. You can go to VolanoVascular.com, VolanoVascular.com, and look up Pivo, P-I-V-O. Eric, hope you enjoyed it as much as we have. We're going to come back in just a couple of moments. Avis is going to join us, Avis Legrone. Don't go away. We'll be back.